Picture this: a weekend at the lake. Weather is warm, kids running towards the water without a care in the world. A wonderful, family fun-filled day when inevitably your little ones come to you complaining of bug bites. Mosquitoes. Oh, those pesky insects. They're everywhere, and unfortunately, we all have to deal with them, and they're no fun. Mosquitoes are known as the deadliest animals on the planet. Mosquitoes can transmit life-threatening diseases like West Nile virus, dengue, malaria, and yellow fever. Luckily, while there are at least 50 mosquito species present in Nebraska, only a few transmit diseases. The 3 prevalent mosquito viruses of human concern that are carried by mosquitoes in Nebraska: West Nile virus, which we hear about every year; St. Louis encephalitis, a virus that can cause inflammation of the brain, meningitis, and in rare cases death; and Western equine encephalitis, a virus that also causes inflammation of the brain. Today, though, we're going to focus on West Nile virus. West Nile virus is something I'm sure you've all heard about and maybe even know a little bit about, but here's the real story of what West Nile is and how we discovered it. West Nile was the leading cause of mosquito-borne disease in the United States. Cases of West Nile occur in the summer and continue through fall. It's a virus that, in most cases, develops no symptoms. But for those who do develop symptoms, experience fever, body aches, vomiting, diarrhea, and/or a rash. Severe symptoms include, but are not limited to, convulsions, coma, vision loss, numbness, and paralysis. Severe illness can occur in anyone, but people who are over 60, those with certain medical conditions like diabetes, kidney disease, and hypertension are all at greater risk. There is no vaccine and no specific medicines available for West Nile virus as of yet. The treatment plan is getting ample amounts of rest, fluids, and over-the-counter medications that may relieve some symptoms. In some cases, hospitalization is necessary. Now that we know what West Nile is, let's talk about how it was discovered. West Nile virus was first identified in 1937 in Uganda and circulated around Africa for the next 60-plus years. It was discovered in the United States several decades later in the summer of 1999 in New York. It's still unknown as to how the virus was introduced into New York City, but some theories include an infected mosquito was brought through shipping or airline cargo, infected migratory birds from Europe came over, infected imported birds or domestic animals were brought over, intentional introduction, or an infected individual came over. Since then, the virus has spread throughout the United States. West Nile virus is spread when a mosquito bites an infected bird and then bites a person. Mosquitoes carry the highest amounts of the virus in late summer and early fall, which is why more people get the disease in late August and early September. As the weather becomes colder, the mosquitoes die off and there are fewer cases of the disease. Although many people are bitten by mosquitoes that carry West Nile virus, most don't even know that they've been infected. West Nile virus may also be spread through blood transfusions and organ transplants. It's also worth noting that it is possible for an infected mother to spread the virus to her child through breast milk. No other human-to-human transmission of West Nile virus through casual contact has been documented, and no transmission of West Nile virus to healthcare workers has been reported when standard infection control precautions have been put in place. State, tribal, local, and territorial public health and mosquito control organizations play a critical role in protecting the public from mosquito-borne disease. They serve on the front lines providing information through outreach programs to the human and environmental surveillance networks that first identify possible human illness outbreaks and emerging risk. They also manage the mosquito control programs that carry out prevention, public education, and mosquito surveillance and control. These organizations determine whether the use of pesticides for mosquito control is appropriate for their area. Two Rivers Public Health Department specifically contracts people to capture mosquitoes. The traps use light and carbon dioxide to attract mosquitoes. They are then shipped to DHHS to be identified and tested for diseases like West Nile, St. Louis encephalitis, and Western equine encephalitis. Two Rivers generally detects West Nile in mosquitoes shortly before or shortly after the first human case is detected. Two Rivers Public Health Department wants to help you protect yourselves from mosquito-borne diseases. Be sure to wear long sleeves this summer or Wear EPA registered insect repellent. Two Rivers Public Health Department